Hello, I'm John Barrett, and I'm one of the faculty members here at the School of Nursing, and today we're going to be demystifying statistics. Today we're going to be talking about number needed to treat and number needed to harm. So what are these two numbers? Well, number needed to treat are the number of people needed to be treated with an intervention to prevent one poor outcome. The reverse of this, the number needed to harm, are the number of people needed to treat with an intervention to cause one poor outcome. So let's take a look at an example. We know that patients with atrial fibrillation have a higher risk of stroke, so we prescribe them anticoagulants like warfarin. Well, there are some studies that help prove that this was helpful, so let's take a look at that. There was a meta-analysis done in 1999 that looked at 9,874 patients with atrial fibrillation and compared the risk of stroke with those taking warfarin versus those taking placebo. What they found was that for every 37 patients who were prescribed warfarin, one stroke was prevented. This number needed to treat was 37. And then if you look at the lower right-hand corner, you can see if those patients who had a previous stroke, that number needed to treat was even lower. You would need to treat just 12 people to prevent one stroke. So let's take a look at how you might be able to actually use this in clinical practice, comparing both the benefits and the risks of treatment. So we also prescribe statins to prevent cardiovascular events. Well, these studies are kind of combined studies that look at different numbers. We're looking at the benefits on the left-hand side of prescribing a statin at 5 years, and if you look at these numbers, you would save for every 83 people that you prescribed a statin for 5 years, the one life would be saved. If every 39 patients that you prescribed a statin, one non-fatal heart attack would be prevented. And for every 125 people that prescribed a statin, one stroke would be prevented. Well, you have to weigh these benefits, the benefits of lives saved, heart attacks prevented, and strokes prevented versus the harms. And the harms for statins are, at 5 years, developing diabetes. For every 50 patients that you prescribe a statin, one will develop diabetes, and for every 10 patients you prescribe a statin, one will have muscle damage. So having an idea or weighing the benefits of the risks are very helpful in clinical practice, and so this is how you can weigh those numbers, the difference between the harms and the benefits, specifically looking at numbers needed to treat. So sometimes researchers won't give you this information, they won't tell you the number needed to treat, but I think it's really helpful to understand and calculate this number because it helps you and clinically make decisions. So let's take a look how to calculate it. It's actually really pretty easy. So number needed to treat, you just basically need to have the absolute risk reduction for benefits or treatment or the absolute risk increase for harms. You just take 1 divided by those numbers. So for number needed to treat, it's 1 over absolute risk reduction, and number needed to harm, it's 1 over absolute risk increase. So I hope this helped clarify numbers needed to treat and number needed to harm. I think this is a very helpful concept for clinical practice and something that you can calculate easily on your own. Please let us know if you have any questions, and thanks for watching.